Thanks for joining us. I'm Jen Bernstein here for The Real Story, a special edition of The Real Story. We're practicing social distancing while still bringing you the long form interviews that are important in a time like this. I hope you all are well and healthy. All right, our first guest up today is John Brady. He is the AFT Connecticut Vice President. He's also a retired RN. John, welcome to the program.
Thanks. Thank you, Jen. Thank you so much for having us on and being able to talk about this important subject.
So first of all, tell us who composes your membership. You represent healthcare workers in addition to other professions, but healthcare workers, you've got a number of people in.
We do. We have about 30,000 members in Connecticut, and about 10,000 of those are healthcare workers. The others are in education and in public service. And in healthcare, we represent 9 acute care hospitals in Connecticut, 1 psychiatric hospital, several visiting nursing associations, and a couple of clinics, and then school nurses, of course. And nationally, AFT is the second largest registered nurse union in the country.
Well, first of all, we certainly salute your members. The sacrifices that they are making for us right now on the front lines needs to be commended. We are all thinking of everyone, and we thank them so much. You are hearing from some of your members some concerning issues, especially around protective equipment. Tell me what they're telling you.
So we are. I think the COVID-19 is an airborne illness. And with airborne illnesses, you need to take protection against that. And you need to wear personal protective equipment, the PPE. And that includes the gowns that we wear for any procedure, the gloves, but it also includes, it should include N95 respirators. They're face masks, but they're the upscale face masks. They block 95% of the particulate matter in the air. So you should have a respirator of that quality or better, and then a face shield just to protect against splashes, and then some head covering, like a hat. They're in short supply. I mean, I think everybody in the country knows what N95 is, and they probably didn't know that a month ago. They're in short supply, and the CDC has put out guidelines because of the short supply. And the guidelines allow healthcare institutions to go a little weaker on it. And they haven't changed what they've said about the coronavirus. What they've said is that if you're running out and you need to conserve supplies, then you can take different steps. And they've made 3 categories. It's a conventional capacity strategy, which is like normal days. There's a contingency capacity, and then there's a crisis alternative strategy. And what I think has happened in some of our institutions where we work is that they have gone straight to the crisis alternative capacity. So where normally, if you went in and took care of a patient, when you left the room, you would take the gown off, take the gloves off, take the mask off, and you would dispose of them, unless they were like a washable gown. And then you would put those in the hamper. You would do that every time you went into the room, and then wash thoroughly, of course. We're not doing anyways near that anymore. We are wearing the same masks for multiple trips into the room at some institutions, and leaving them at the door in a paper bag. That carries risks of when you put it back on, you could contaminate yourself if there's something on the outside. We are in some institutions now wearing them for the day or for the week. And we have been fighting just to get the fact that we actually get N95s to wear at all, as opposed to surgical masks, which don't carry the airborne protections. So it's been a real struggle, and it's for nurses and health professionals who have been taught their whole life what infection control practices are. You're asking them to go against everything that they've ever been taught. They understand that maybe they need to do this. We have been yelling for what the inventories are, what supply chain looks like, and we've had a hard time getting those answers. Even though in the press you get mixed messages, you probably heard it. You'll hear
Yeah, I mean, that was my
You'll
question
hear
to you. What are
one
hospital
person say,
administrators? What are hospital administrators and what are they saying about that supply line?
they're not giving us clear answers. We got one clear answer, and that was that there was about a 21-day supply of the medium-size N95s, and there was a 9-day supply of the small N95s, and that they felt that their supply chain was good. They thought it would look pretty solid. But I've heard them on the press say that they're in good shape and that they've got enough for the month. And I've also heard them on the press say that we're almost out. So we're having a difficult time finding out what the truth is in that. And that really leads to a lot of anxiety amongst the staff. And, you know, we really want to keep
we
staff,
have heard from
healthy.
healthcare leaders that that they do have a supply right this moment, but that it was running out very quickly. Which is similar to what you said, you know, the press is saying or has heard from leaders. But yes, we have not necessarily gotten specifics on a date or a time. And that could be because obviously of the unpredictability on how many cases are going to come in the following weeks. But I'm sure it doesn't give your workers a peace of mind by any means.
No. And our workers are willing to stretch the supplies. They're willing to take a mask and wear it for the entire day. They're willing to use it the next day if they have to. They're not thrilled about it because they worry about how effective it is and they worry about the infection rate. And they're also not thrilled about it because it's not what they were taught. It's that you know when you go in a room, you leave what you brought into the room in the room. You don't bring it out and use it somewhere else. But they're willing to stretch that because they realize that they're in unusual circumstances. They're in a war zone, and they're willing to do that. But they want to be safe at work for themselves. But they also want to be safe for their families, so they don't bring something home, and for their other patients, that they don't spread something to someone else. So you know they want some clear guidelines, and that's been difficult. Some of the hospitals have been good about coming out with what their policies are, and others have been very vague, so that on some floors they'll do it one way, and on another floor they'll do it the other way. And I believe that some of the supervisors aren't even sure what the rules that day are. So, I mean, our members have been pushing back, and they've been saying, no, that's not safe. And in the instances where they have pushed back and where they have said, it's not safe for me to go into that room as a surgical mask. That patient has symptoms or that patient has tested positive. Where they've said that, they're getting some pushback. But where they continue to say that, management has backed down, and they are doing it the way they need to do it to protect themselves. And they're worried
John,
about
have any of your members contracted COVID-19?
Yeah, we've had. Last I knew, we had about 8 across the state. I haven't had a chance to check in today. Today is Friday, and I haven't had a chance to check in to see if we've got more. None of them are serious, thankfully. But I know that in New York City, one of our largest locals, AFT locals in New York City, United Federation of Teachers, has about 900 hospital nurses. And I know that the last time I spoke to the leadership down there, they had, I think, 24 of their members hospitalized, not just contracted it, but hospitalized, and 2 of them were on ventilators. So, you know, I worry that that's going to happen to some of our members. And I worry that, you know, we're going to lose some of them. And that's what keeps me speaking out.
What does the governor need to do? Is this pressure on the hospitals from you all? I mean, obviously you would want their leadership to make your members feel more comfortable, but is there something on the state side that the governor can be doing at this point?
We have been in talks with the governor. We have a good relationship with the governor, both on the education side, the state employee side, and the healthcare side. We've been in talks with him, and the hope is that we can come up with kind of a unified statewide guideline that probably will have to change, maybe from day to day, week to week, but that they can put out what the statewide guidelines are, so that our members and other non-members, non-unionized workers, and administrations will know these are the guidelines the state says you should follow, the minimum guidelines. And I think that would go so far to relieving the confusion and some of the anxiety over this. I mean, there's enough anxiety just because they're dealing with a virus that they've never seen before. And so we're hopeful that that's going to happen. We're hopeful that we will involve frontline bedside people in that process, so that we can make it a good guideline. We're pushing for it, and the governor's office is receptive to it. But things move slow. Everything except for this virus moves slow.
Well, you'll certainly have to keep us updated on that. That would be interesting if some kind of legislation or a mandate, executive order, or those guidelines did come out for all the hospitals. We know the governor has assembled a health system response team, and you were critical of it from an email that I had read that you had written. And that included, obviously, the governor's office, as well as the CEO of the Connecticut Hospital Association, the presidents of Yale, Hartford Healthcare, of Nuvance. Tell me what you feel when you're seeing everyone stand up at the press conference and talk about this response team. You felt like there was something lacking with that representation?
What I don't see is I don't see the workers. I don't see the people, the doctors, the nurses, and the technicians that do this for a living. And if you're going to be advised on what should be done next, I think the voice of the workers is so critical, especially when it comes to something like medicine, which is, you know, it's not a first language to most politicians, and frankly, not even to all healthcare CEOs. Some of them are not necessarily from healthcare backgrounds. Yeah, like the guidelines, I think that panel needs to have some people that actually work in the trenches, so that their voices and their opinions are heard, and their guidance.
Well, John, we really appreciate you coming on The Real Story and flushing out some of the things that you are hearing from these frontline healthcare workers. Please tell them that we are thinking of them, and we thank them so much for everything they're doing. And of course, we want them to be safe. So I appreciate you bringing some of these issues on this program. It's important to talk about. John Brady from AFT Connecticut, the vice president there, also retired RN. Thank you.
Thank you.